Hello, everyone, and welcome to the latest session of Ask Dr. Sharon. I'm Sharon Walt, the Hashimoto Health Coach, and I am delighted that you're joining me here today, either in person or if you are watching the replay. So the reason behind the Ask Dr. Sharon series is to answer any questions you might have about autoimmune conditions in general and Hashimoto's in particular. So today, what I want to talk about came about because I had a potential client who was concerned about the cost of all of the testing she thought that she would have to do in order to start her healing. And this would be kind of the functional testing. So these takes into account kind of things like comprehensive stool analysis or hormone analysis or food sensitivity analysis. Which can get very, very expensive very quickly. So today I want to talk about one of the key tools that I use to identify root causes and the process that I use. And that doesn't involve functional testing. Now, I'll demonstrate this with a case study, me, and my most recent blood test results. Now, I'm quite aware that this is kind of a very simple demonstration because I don't have much in the way of symptoms, which is very much different from anyone that's got full-blown Hashimoto's. But it should be sufficient to just explain the strategy that I use. Okay. So when I first start working with a client, as I said, I don't insist on any functional testing because they tend to be very expensive and generally not necessary at this stage. Now, they can be very useful to fine-tune a healing strategy or provide information to clarify a situation, or even to fast-track a strategy by removing some of the trial and error processes. But initially, I analyze the fundamentals. So that is what and how a client is eating and what lifestyle practices are impeding their healing. Because what I found out is that these fundamentals are the types of things that are going to have the most widespread improvement in one's health. So if you get that out of the way, you're going to start feeling better, and then we can start working on any symptoms that are kind of left over. But even before that, I want a more complete picture of their health, and the results of a comprehensive blood test, along with their health history and their symptoms, that will give me that. So what do I mean by a comprehensive blood test? Well, it's generally nothing more than that you should be getting done every year. So this would include things like a whole blood count, or it's sometimes known as a complete blood count, which is a breakdown of the state of your red and white blood cells. It's also going to include liver and gallbladder function tests, kidney function tests, a lipid panel, and your blood sugar levels. So this sounds like a lot, but generally, they're going to take a few vials of your blood, and it can all be analyzed actually within a couple of days. Now, also, if it's possible, you could ask for a full thyroid panel. Now, I'm well aware that that's pretty difficult to get currently, but you can ask for at least the minimum. And the minimum to kind of check out your thyroid function would be TSH, free T4, free T3, and antibodies. So that will give the bare minimum to try and assess the function of your thyroid, plus try and point towards what's causing the problems. If your GP is unwilling to provide a script for a comprehensive blood test every year, well, you may consider either changing your GP, and I know that can be problematical in itself, or you can consider paying privately for these tests. Now, in a lot of cases, some of these tests really aren't that expensive, and given that they can provide a lot of information about the state of your health, it may be something to really consider having done. Okay, let's get back to the process here. Now, when I look at the results of blood tests, I first check which ones are out of range. Now, the range that I use is based on optimal health. So that's a comparison of the results of a whole lot of people that are right now experiencing good health. They're living their life to the fullest. This is not the same reference range used by labs. Their range is based on the results of people who are asymptomatic, so not showing any symptoms. This is not the same as experiencing good health. I mean, you could be right on the verge of starting to get some serious symptoms with a chronic health disorder, but you're still within the range. So I then look at any patterns or connections that emerge between aspects of the health history, the symptoms, and the blood tests. Now, it's the patterns or the interconnections that are important and that can help in identifying root causes. Now, this obviously takes some time to do. Now, it's time that your GP probably doesn't have. Okay, let's look at, now we've looked at the process in general terms, let's look at my case study. I just got the results from my recent blood tests, and I'm happy to share them with you. Now, I was fortunate to have a comprehensive set of blood tests done, although not a full thyroid panel, just TSH, but more on that a little bit later. Now, what came out of it? Well, there is 3 notable results. And interestingly, my GP didn't pick up on any of them. Now, first one, as I mentioned, a complete or a whole blood count analyzes the state of your white and red blood cells. An analysis of white blood cells looks at the number of different types of white blood cells that you have in circulation. And it's your white blood cells that are the main factors of one's immune system. Now, my white blood cells showed that I was in the recovery stage of a virus or an infection. Now, when I looked back over my symptoms for about the past month, this made sense because I had just returned from a 3-week hiking trip and I was feeling really dragged out. And this wasn't just from the fatigue of, what we were doing. And I realized that I had been exposed to a lot of other people in airports, on flights, in our accommodation. And this is on me, I hadn't been consistent or rigorous with mask wearing or any of the other things that you can do to, stop from getting infected. Okay, so that was the first thing. And this is something that I always check on my clients because we want to look at the state of your immune system because that's one of the main triggers, a hyperactive immune system that will trigger a problem with your thyroid. So looking at that is really, really important, and it can give you heaps of information about what's going on. Okay, second result. And this was the analysis of my red blood cells, and this was the most striking. Now, this analysis looks at the number of red blood cells, the amount of hemoglobin, and the size of the red blood cells, among a few other things. Now, my red blood cells are too large. Now, what's the significance of this? Well, red blood cells that are too large have trouble moving through the small capillaries in your circulatory system. So typically these are in your hands and in your feet. It's considered a type of anemia, and it's indicative of a deficiency in vitamin B12 or folate. Now, this result made sense because for the past couple of years, I've experienced some numbness in the soles of my feet. Now, the general cause of numbness in your feet can be due to metabolic syndrome or prediabetes or full-blown diabetes. But I knew this wasn't the case for me because my blood sugar regulation tests were absolutely fine. So thank God it wasn't a problem with diabetes. So what else could be causing a nutrient deficiency? I get enough B vitamins from my diet. But as you probably well know, consuming a nutrient isn't enough. You also need to digest it. You also need to absorb it. And I believe that absorbing vitamin B12 is the problem, really, for me. So why is that? Well, as one gets older, production of stomach acid decreases, and we're really not sure why this happens. You need stomach acid to not only digest protein, you need it so that certain key nutrients can be absorbed. So things like your B vitamins, iron, calcium, magnesium, selenium, and zinc. Now, try and remember some of these nutrients here because they're kind of important. They come in a little bit later. So less stomach acid, less absorption of these essential nutrients, resulting in deficiencies. And in my case, larger red blood cells and anemia. Okay, what can I do? Well, this is a relatively easy one to solve. I've started taking some supplemental stomach acid with every meal and redo the blood test in a couple of months and also track my numbness to see if it resolves. Now, this is also another key thing that you can be doing. If you're going to try to do something to resolve some of your symptoms or root causes, it's really important that you track your symptoms so you can see if there's any improvement or no improvement or, worst case scenario, things get worse. Okay, so that was one of the most striking results that I have in something that I'm doing right now. Okay, the third result, and the last one is my TSH level. Now, I normally don't have thyroid tests done as I haven't had a problem with my thyroid for a few years now. So just as a bit of a recap here, I had suffered from hypothyroidism from chronic high stress. Now, when I resolved the stress, I healed, so no problem. Getting back to my TSH result, it was a bit higher than it should have been. Now, a TSH result without an analysis of your T4, T3 levels and your antibodies is pretty useless. It can be high for any number of reasons. But combining this result with that of my red blood cell analysis, and I came up with a likely scenario. Now, remember the relationship between stomach acid and absorption of some of these key nutrients? Well, 3 of those key nutrients were zinc, iron, and selenium, which are needed to make thyroid hormone. So, following the breadcrumbs here, low stomach acid, poor absorption of iron, zinc, and selenium, resulting in less T4, which is then reflected in increased TSH. So what can I do? Well, taking supplemental stomach acid should resolve this too. Plus, I'm going to track my symptoms. If I start showing some symptoms of hypothyroidism, then I'm going to have to look at this a little bit more carefully. Now, my GP, who is wonderful, by the way, didn't pick up on these. Why? Well, because it takes time to correlate your blood test results with the symptoms and the health history. And no matter how good your doctor is, they would rarely have the time to do this. And unfortunately, that's the state of our healthcare system. Okay, now, as I said, that was just a snapshot of the strategy that I used to identify and resolve some common root causes. So recapping, comprehensive blood tests, complete health history, and symptoms. You look for the patterns and interconnections among various body systems, as well as health history and symptoms. Simple strategy, but not necessarily easy, and it does take some time. So, what's the take-home message here? Well, most importantly, you can get quite a bit of information about initial root causes from just analyzing and correlating everyday blood test results with your health history and your symptoms. There may not be a need for expensive functional tests until some of the more fundamental root causes are identified and resolved. So don't let the thought of expensive testing get in the way of starting your healing. Can you do some of this analysis and investigation yourself? Well, yes, but it helps if you've got a good background in human physiology, biochemistry, and also how to analyze blood test results. More likely, you will need some help from someone with expertise with this. Okay, and not to blow my own horn too much here, that's what I do. So if you have some questions about what I've talked about today or some questions about your health, you can book a free 20-minute consult with me. and we can discuss your concerns and what you can do about it. Now, I'm just going to put the booking link on the, okay, so it should be in the comments. It's also on the banner here. So I'll leave it up for a few more seconds here. And said, please feel free, book a session with me. It's free. It's not going to be a hard sales call by any means. I just want to have a discussion about what your main concerns are and some of the things that you can do to get started on your healing. Because you can always find a way to move forward and to resolve a lot of your symptoms and hopefully your root causes as well. Okay, everyone. I hope you've enjoyed this and found it useful. As I said, if you've got any questions, you can put it in the comment section below, or you can private message me and I will get back to you. Okay. I hope you enjoy the rest of your week, and we will talk soon. Bye for now.